Well, good evening, friends, and welcome. That was a little bit exciting, trying to figure out this whole thing. We had a little bit of a technical snafu, but we're not going to keep us down from sharing the message of health. So we had to change to a different platform, but we're going to share the message tonight, and I'm excited to be with you all, and hopefully we can navigate whatever went on there. So here we are this evening to share and discuss and talk about perhaps one of my favorite topics of all time, and that is the intersection of the musculoskeletal system and your orthopedic health. This is such a inadequately discussed topic, and yet one that has so much amazing value because all of us want to feel good. None of us like to hurt. And we all have different levels of performance that we would love to achieve, right? Whether that be the ability to run up a flight of stairs, to play our favorite sport, or just simply to pick up a box and carry it up, into our home. So we're going to get into some good stuff tonight about why what you do with your fingers and your feet can radically influence kind of your ability to live and perform at the level you want. I think most of you know my background, and that is, you can see here, I grew up at this amazing place called Esther's Ranch, where I saw miracles on almost a daily basis. And so I'm here to tell you miracles do occur, and the personal choices you make are incredibly powerful. And so I just always want to give a shout out to my grandfather, who I will always be on his shoulders, really the rest of my life, no matter what. Um, so, um, Again, tell your friends and family if they're not on to sign on for this. This is a crucial talk, and I think everybody's going to enjoy it. You'll get some good value out of it. So I apologize again for the delay and get it started. But quickly, anybody you know, tell them, get onto YouTube, watch this video, and then they can drop some questions in too. I'll take a bunch of orthopedic musculoskeletal questions at the end if you want a quick curbside consult, as they say. I think most of you know my training, right? I had the pleasure of going to the University of South Florida for medical school, Harvard for residency, Mayo Clinic for fellowship, spent a bunch of years, team physician for UNF Division I athletics for 7 years, a bunch of faculty positions but for family medicine, sports medicine, internal medicine, so on and so forth. And I want to start with this nice gentleman who's smiling right here, right? I want to give you an example of you don't have to be a professional level athlete, in order to appreciate feeling better. This guy was a ranger on the golf course. He had been pulled because of his knee pain, his back pain, his legs swelling, right? He had all these problems and he was on tons of medications for all these problems. And when he and I had a conversation, I said, what have you got to lose? Give me 4 weeks of your life, 4 weeks, and let's see what can happen. So I put him on my 4-week detox and he came back and pretty compelling. He was 31 pounds lighter. Knee pain, back pain, gone. Leg swelling, gone. Normal blood pressure, off medication. Hadn't seen his cholesterol levels yet. But the beauty of this all was not that his numbers were better, but that he felt better. He felt a level of joy he had not felt in years. And you could see it in his smile. And in fact, they put him back out as a golf ranger, right? So he's back out doing what he loves and enjoys. And that's what I want to remind you of, right? The personal choices that you make are radical predictors of your ability to enjoy life to the full. So tonight we're going to explore the intersection of orthopedics and nutrition. We're going to discuss some implications to what you do and hopefully set some lifestyle goals. So let's get in there, right? If you're somewhere out west watching this and it's dinner time, go make your food, right? You're 3 hours earlier. If you've already eaten, well, maybe get a little nice tea and sit back or a nice cup of water and relax, put your legs up and let's chat. Or if you have a recumbent bicycle, maybe you sit on there and pedal a little bit while we're chatting. So definitions, right? Orthopedics, this is this whole field of medicine that I live in, working on bones, muscles, tendons, and ligaments. Nutrition, of course, studying the effect of nutrients that we consume. Performance, right? The action or process of carrying out or accomplishing an action, task, or function. And potential, that's what you and I both have. I saw a great quote. I think I actually just threw it on Instagram that said something to the effect of just because you haven't achieved the ideal does not mean that you should give up on the idea. Right? Just because you're not perfect right now doesn't mean you should give up on thinking about how you'd love to blank, right? That ideal that motivates you, that you admire. I want you to be thinking about that and working toward that moving forward because you're amazing. You're made of 37 trillion cells, 206 bones, 600 muscles, a couple pounds of skin, right? 100 square miles of blood vessels, 7 trillion nerves. And every 7 to 10 years, your body replaces itself. Every time I think this, my mind just goes, I'm blown away, right? So then it tells me, yeah, it matters that I just ate those red peppers. It matters that I just had that red beans and rice. It matters that I'm sitting here and I've got some fresh hibiscus tea to have a little sip of. Because every sip, slurp, and bite is changing my cells. It's changing what's happening at the cellular level. Because we're this beautiful, enmeshed layer by layer by layer of body. And each cell requires nutrition, hydration, oxygen, and the removal of toxins. So we've got nutrition, right? Which of course is universal, it's modifiable. We all have to eat. We have the ability to change what we're consuming. And it turns out nutrition is insanely powerful. You know, every cell requires nutrition, oxygen, et cetera. And the food that you eat, the exercise you get, the sleep you engage in, the thoughts you think, and the toxins you're exposed to all radically influence what those cells of your body receive, which is pretty cool. So it really predicts your health at the cellular level. So I want you to consider something. You know, we have the most rapidly aging population. We have the most obese population in the history of Earth. And, you know, there's this generational shift happening where more people want to stay active rather than just sit on the couch, which is a good thing. When I see people who come to see me in clinic, on average, they come because they want to reduce or manage pain, some because they want to improve healing or performance, and some because they want to maximize their general health. An area that I see overlapping for all of these individuals is nutrition. And how? Well, through its influence on inflammation and perfusion in particular. Perfusion, we could say, rules, right? Because without good blood flow to tissues, they're unable to perform at the level that they need to perform at. Blood flow, of course, is required for our survival, maximizes our function, enhances performance by delivering oxygen and micronutrients, slows the aging process, right? It promotes healing, facilitates recovery, all of these things. And it turns out that food controls the contents of your blood, and food also controls and alters the flow and the delivery and the function of these blood vessels, right? Because the heart pumps, the blood flows out via that left ventricle into the aorta, then through the rest of the body via the arteries, and then back through the veins. Nitric oxide, of course, being this substance that dilates the blood vessels and decreases pressure back on the heart. Now, in opposition to this, of course, is atherosclerosis, which is, of course, the hardening of the blood vessels, this fatty buildup of cholesterol, saturated fat, calcium that it oxidized and is stored in the endothelial lining of the blood vessels. Now, a high-fat, high-cholesterol meals plays havoc with our blood vessels. It impairs vascular dilation, the opening up of the blood vessels. It impairs blood flow. It reduces oxygen and micronutrient delivery, and it alters the pH, right? Increasing the risk of death for all of us. So when I draw blood, I do, as you know, PRP and stem cell in my clinic all the time. When I draw blood and I get the plasma, the water and content, you know, you can appreciate on both these images, the people with kind of clear plasma here and here are individuals who just had big salads versus those here and here are people who just had high-fat sandwiches, right? Like a Cuban sandwich and a fish sandwich. And as a result, they had lipemia circulating through the bloodstream, clogging up, right, their blood vessels. This is a perfect example of that. This is somebody who had just had this salad, a Capital Grille Cobb salad, which is, of course, 65% of calories are purely from fat. And this is the level of lipemia, tiny little fat particles in their bloodstream, as compared to someone who had a true salad over here. We know this in the data. It's not just anecdotal, of course. Researchers at Johns Hopkins have demonstrated that even a single high-fat, high-saturated fat, high-refined sugar meal inhibits blood flow by up to 50% for 4 hours at the cellular level. But on the flip side of that, people who consume foods that are rich in nitrates, like berries and greens and dark chocolate, these actually dilate the blood vessels, which is pretty cool. And as a result, individuals are able to have improved blood flow. whether this be to their genital organs, whether this be to their brain, whether this be to their kidneys, whether it be to their muscles and their bones, as we'll learn, that is so absolutely crucial. Because food is information, right? The food on the left side of the screen is saying very different things to your cells than over here. Now, you may have already had an emotional response to this food. Next week, I'm going to give a talk on emotions and eating. When you look at the right, you look at this food, it's very dopaminergic. You look at it immediately, you may have a sense of, oh, I like that. Those fries, that sundae. And you look at the left, you go, oh, that's a lot of chewing. But the reality is, it's not so much about the feel, the mouth feel of the food that we should be focused on, but rather the influence on our cellular health, both today and for years to come. Because what you eat, right, it predicts what's in your blood, the cholesterol, the fat, the sugar, the proteins, the micronutrients, and it predicts the function of your blood vessels, how thick the blood is, how inflamed the blood is. In other words, how likely for this blood to clot or to cause distortion or dysfunction, as well as how much pressure. We know that 1 in 3 Americans have a high blood pressure, and the highest correlation is to our diet and our nutrition, in particular that of salt that we consume excess quantities of. Now, when we talked about blood flow, we would be remiss if we didn't discuss nitric oxide. Nitric oxide, of course, is this product, right? This molecule that causes dilation of our blood vessels. And it turns out that various food products like deep green, deep red vegetables actually are converted from nitrates. They're converted by bacteria in a mouth, in the stomach, or in the intestines, as well as by chemical reactions in the red blood cells in the bloodstream. These nitrates are converted into nitric oxide, which facilitates, again, vasodilation. We want this. I mean, even things like flavonoid-rich apples, it turns out, improve endothelial function, right? So the old adage of a doctor, apple a day keeps the doctor away, turns out is true when it comes to our blood vessels. So those flavonoid-rich apples, along with things like I mentioned, here's that spinach, right? Improve endothelial function. Remember, endothelia is the lining of our blood vessels, which is chemically reactive. These are alive cells that have the ability to either soften and relax and the blood vessel opens more, or those tiny cells harden and become dysfunctional. Flavonoids are fascinating. I'd like to talk about them briefly. So they're a little carbon metabolite that give plants their color, aroma. They protect them from the sun. They attract pollinators, right? And help with drought resistance, et cetera. And you and I, it turns out these same flavonoids are antioxidative, anti-inflammatory. They modify our immune system and they're anti-carcinogenic. So some of those flavonoids, right, here they are, 4 different classes: flavonones in the citrus, anthocyanidins in all those beautiful berries and cherries, the isoflavones in our soy products in particular, and our flavonols that we see in things like the apples that you see there, strawberries, various types of the alliums, so like the onions, garlic, etc. And so these different flavones, right, have this potential to have very powerful positive effects, right? And there are a whole host of others. You can see some of them there, right, that we find in different areas of our food with fun names like quercetin and and the rest. So you can see them all there and look at this later. But a lot of fun to recognize that these food products that we find here in our food have, very powerful effects on our health. So it's not just about, oh, you should eat your fruits and vegetables. No, this is deeper. This is about, do you want to turn off inflammation? Do you want to turn on healing? Do you want to promote stem cell activation? Do you want to improve blood flow? So these high nitrate solids, right, they increase plasma nitrates and increase dilation in your blood vessels. And so the more of these that we eat, the more positive effects that it has. Now, this is the opposite of consuming more of a Western style pattern of food, high in processed meats and sweets and fried foods, etc., where we have increased inflammation at the cellular level. So again, we want more nitrates in our bloodstream. I love this, right? A vegetarian diet shown to contain approximately, right, almost 4 times greater amounts of nitrates than the average diet. Now, you can, as soon as you've watched this video, you can in fact change, right? You can. So every meal you can say, well, I'm going to add a little bit more greens to every meal. I'm going to add more blues to every meal. It's that simple. Starting to add it in every day in every way. Again, that takes us back that food is information. So you might ask this question, and you should. Well, Dr. Esser, that's fine and good. Blood flow is important, but how does blood flow or perfusion affect my orthopedic health? Let's get in there. I'm glad you asked. Let's start with the nerves. So your nerves, hair thin, little teeny tiny nerves, have even smaller blood vessels connected to them. We call these vasonervorum, blood vessels to the nerves. And they are itsy bitsy teensy tiny. It can only be seen under the microscope. And so imagine if they're that tiny, and yet your big blood vessels, like in your heart and your legs, are already getting a little clogged by your diet. Well, what about these teeny tiny blood vessels? My goodness, they might not be doing so well. And it turns out when these little tiny blood vessels don't do so well, what happens is we get impaired perfusion. When we get impaired blood flow or perfusion to muscles, they then are more likely to go into spasm. And when those muscles go into more spasm, we're more likely to have pain related to these trigger points, quote unquote. And so trigger points turns out have, if you sample the blood in the area of a trigger point, it's very acidic. And it has all these different inflammatory molecules, bradykinin, substance P, interleukin 1 and 6, all these nasty things. And when you improve blood flow to these areas, the pH increases and we wash out this chemical swamp. And now, as a result, nerves are less likely to be irritable. Because studies show that if you have an unhealthy chemical environment that is more acidic in your muscle tissue, you are more likely to have chronic pain because the pain receptors are more likely to fire in an environment that is acidic. So just like you and I are more likely to be depressed or anxious if we live in rough neighborhoods with gunshots going on and a lot of crime, in the same way, your muscles are more likely to be on edge and anxious and tight if they are in a chemical environment that is unhealthy. But when we change that chemical environment, pain improves. That is at the simple myofibril level of your muscles. So if, for example, you struggle with chronic sort of spasms, tight, twitchy, unhappy muscles all the time, chronic muscular pain, by simply adopting a high micronutrient flavanol and nitrate-rich diet for 2 to 3 weeks, you should expect your pain to decrease by 60 to 70%. That's what I see when people do, for example, my 4-week detox. A ton of their pain improves. And I think I'm going to restart my 4-week live program starting in October. So in 1 month, just actually 2 weeks. So I'll be posting that up later today. And I hope you guys will join. For those of you who like learning, want support for a good 4-week program. Now, if you have impaired blood flow to your spine, studies show you're more likely to have chronic back pain and degeneration of your spine, early disc drying out, early arthritic changes. Why, you should ask? Well, take a look. You've got the aorta, the largest blood vessel here of the body, and wrapping around the bones are these little tiny feeder vessels. Well, if you end up with aortic calcifications, you can see white right here. There's this calcium deposited along with the cholesterol and saturated fat. And we end up with decreased blood flow through those little tiny feeder vessels, right? If you end up that this is all thick with cholesterol and calcium, well, then you're not going to be able to get good blood flow through these feeder vessels. And as a result, you're not going to get the oxygen and the micronutrients to keep your spine healthy. In addition, your bones get less healthy if they have impaired blood flow. This is a great example of that. We have osteoporosis and perfusion. Studies show that if you have those aortic calcifications, which are related to elevated cholesterol and inflammation, you have higher rates of osteoporosis throughout your body. So there's this interrelationship. The bones are alive. They need good blood flow. So if you've got impaired blood flow, you are more likely to develop osteoporosis because the bones don't get the nutrients that they require to be healthy. What about tendons? Well, the tendon is a connection between a muscle and a bone. And these tendons are made of lots of little tiny subtendons, all wrapped together, all that collagen, and fully invested with lots of little blood vessels. Now, studies show us that if you have elevated cholesterol, you're more likely to have tendon tears. And you're also more likely to have re-tears after surgery or failure of surgery, whether it be rotator cuff or whether it be Achilles tendons. So what a great reminder to us that we need to take good care of our bodies so that we could decrease, right? We could decrease the likelihood of tendon tears. What about the cartilage at the end of our bones? Well, it turns out blood flow is crucial for them as well. Multiple studies now showing that if you have elevated blood pressure, you end up decreasing blood flow to the cartilage layer of your knee. Because if you have increased blood pressure, you increase pressure intraosseously. Intraosseously means inside the bone. And as a result, these little tiny feeder vessels get cramped, smushed. They're not able to deliver the oxygen and the nutrients to the surface of the bone. Nerves, as I mentioned, if this nerve lacks adequate blood flow, the nerve dies off. This is why people with peripheral vascular disease, where they lack good blood flow, end up often with, peripheral neuropathies as well. Diabetic neuropathies, which are strongly related to inflammation at the blood vessel level, turns out that individuals who consume a micronutrient-dense plant-based diet can have a radical resolution of their peripheral neuropathies within weeks. And I see this all the time with my patients who develop who are willing, I should say, to go on my 4-week program. Their diabetic neuropathy radically improves as a result of the healthy decisions they make. Now, food alters blood flow. Impaired blood flow alters all those things. You correct the food, you correct the perfusion. You correct the perfusion, you enhance musculoskeletal function, you reduce pain. Of course, you also reduce your risk of dying from things like heart attacks, which you don't want. Now, the beauty of this message is that there's a BOGO. That's what I'm telling you here. I like BOGOs. I don't know about you. BOGOs are great. Buy one, get one free, right? And that is that when you consume a micronutrient-dense plant-based diet, not only do you reduce inflammation and improve blood flow, but you also reduce your risk of death from the most common chronic diseases, in particular that of heart disease, which is the #1 killer of men and women in America. So your perfusion plan, your blood flow plan should look something like this. Eat 6+ servings of raw or steamed vegetables a day. Eat 4+ servings of raw fruit per day. Drink 64 ounces of water or fresh green juice per day. Moderate movement, and then reduce the junk. Looking back in my day today, whether I hit the greens or not, I don't think I did. I had steamed spinach. I had some barley grass. I had a big, I had a head of lettuce. So that's only 3 or 4. I mean, I guess we're going by servings. Well, I had more than those servings, but I'd love to hit my cells 5-6 times a day. In fact, you just grab a handful of arugula, grab a handful of spinach, throw it in your mouth and chew on it, and then flush it down with some water. You immediately cause a little bit of a burst in nitrate production in the next 20-30 minutes that helps to facilitate improved blood flow to your brain and the rest of your body. Now, inflammation appears to be at the heart of many diseases, and there are 3 major causes or types of inflammation we're going to talk about tonight. That includes functional, adipose-related, and autoimmune. Functional inflammation refers to the fact that when you are physically active, whether it be at your job, your work, or recreational sporting activities, you produce what are called myokines. Myo making reference to muscle, cytokine being an inflammatory molecule. And so inflammatory myokines, right, are produced as a result of your exercise. And this sort of inflammatory sort of molecules circulate through the bloodstream, and they increase the likelihood of you being sore after exercise. Some of that delayed onset muscle soreness that you feel within 48 hours of exercise, along with other inflammation throughout the body. So when you acutely exercise, right, there's this massive upsurge of systemic inflammation. Now, the more regularly you exercise, you improve the cellular efficiency of your body. Exercise helps balance out your hormones, and it has health benefits like reducing your blood pressure. But still, even if you're a regular exerciser, you do produce inflammation as a result of your activity. And you need to get rid of that inflammation with excellent hydration so you can flush it through your kidneys, as well as through the micronutrients. That's why now when I exercise aggressively, the first thing I think of right after exercise is I need to reduce inflammation. The second is that I need to replete my calories, right? That I expended or used. So good news for you and I is that increasing your consumption of plant-based matter appears to have positive effects on reducing many of these myokines, right? And improving cellular efficiency. So we get rid of these interleukins, we get rid of things like fibrinogen and CRP, we decrease the amount produced, thereby reducing inflammation at the cellular level. In particular, foods that are rich in anthocyanin pigments appear to have very powerful effects and high polyphenols, right? So all of these deep purple, reds, blues that you see here, from the beets to the red onion to all the wonderful berries and currants, etc., all of these reduce inflammation, improve power production, and have a decreased strength loss. So again, if you like to work out hard, if you're in there performing at an elite level, Division I athletics, professional, athlete, or whether you are just in the CrossFit gym or out on the tennis court working hard, right? Regardless, we want to be able to do those 2-a-days, 3-a-days. We want to work out hard. And in order to do that, you need to lose less strength, have less soreness, right? And get your power back more quickly. Again, micronutrient dense, anthocyanopigment rich foods do that for you. Some various forms of this that some people like to play with include beet juice, tart cherry juice, pomegranate juice. These are fun, very efficient and simple ways to get some of these products in. If you're going to do so, just make sure that they are the whole juice and nothing but the juice, not the concentrated forms with added sugar to them. That is not going to cut it. If possible, make your own fresh, right? But simple things too. Grab a little bit of beet, throw it into your smoothie in the morning, right? If you have a good high-powered blender, it'll just disappear in there. And continue to try to add these things in their natural form as much as possible. Because if you're wanting to stay active, the good news is that the more micronutrient and plant-based foods you consume reduce inflammation, get leaner body type, facilitate storage of your blood sugars, so that you could use them, right, in a glycogen form. They improve your blood cholesterol levels and drop your blood pressure. Kind of, again, win, 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 and more win. So the take home is that the more micronutrient dense plant-based foods you eat, you end up reducing functional inflammation production and the negative effects. Now, adipose-related inflammation is a real issue. We call this meta-inflammation, and the adipose tissue that we store, in particular in our bellies, our visceral fat, is some of the most dangerous. This belly fat is producing adipokines. Here's that term again, adipose fat and cytokines, inflammatory molecules. So these adipokines circulate through the bloodstream and play havoc not only with your bones, tendons, ligaments, but also your blood vessels, your heart, and so much more. Truly, it is a factory of toxins. I see patients all the time, and I see folks at the beach frequently here in Florida who seem to have adopted the mindset that having a 6-month pregnancy-sized belly when you're not pregnant is acceptable. And it may be acceptable aesthetically, that's not the issue here, but from a health perspective, carrying that extra visceral fat inside of our bellies is absolutely just toxic to the rest of our overall health, right? Every type of hormonal cancer, liver disease, blood pressure, type 2 diabetes, the list goes on, that have been clearly related to our carrying of extra belly fat. So we need to bring that down, right? Because not only do these adipokines cause inflammation at the cardiometabolic level, but it turns out they increase the rates of osteoarthritis, of generalized pain, of spinal degeneration, and of also, as I mentioned, all these things like dementia and heart disease. The good news is when you lose weight, you decrease adipocyte production. And when you decrease adipocyte, presence, then you also decrease adipokine production. And so it's just sort of this downstream effect. Lose the weight, decrease adipocytes in the size, and then decrease adipokine production. Plants, of course, have the lowest caloric density. So if you're consuming largely in the green, you're going to be able to eat all day, all night, and you're still going to be at a healthier weight. Versus if you're eating the more processed foods as well as the fatty foods, you have to really control how much you eat, which is not very fun. Our final area of inflammation is autoimmune. And we'll do a whole talk here soon on this. Genetically predisposed individuals get an environmental trigger where they have leaky gut. They then get molecular mimicry and off they go to the autoimmune disease. So the more plants that people eat on average, the lower the rates of all autoimmune diseases, whether it be rheumatoid arthritis, MS, whether it be inflammatory bowel disease. Eating more plants appears to be protective versus the more meat and dairy we eat, there is an increased rate of autoimmune diseases across the board. Once again, pretty much in all of its different forms, there are increased rates. So this was, I think, a great quote from this article that was published in 2018, just kind of stating, right, that a treatment of, for example, rheumatoid arthritis with a plant-based diet is affordable for the patient, no adverse reactions, mild cases it can suffice as a single monotherapy, right? And for moderate to severe cases can serve as an adjuvant, right, or an adjunct therapy for drugs, medications. So again, very powerful results. And this is what we want to continue to kind of advocate for, because the science and the data supports this. So we should be adding it into our day-to-day routines. So plant-based eating reduces autoimmune-related inflammation. Now, not only do we improve blood flow, reduce inflammation to our joints and structures, but it appears that food can also facilitate regeneration, the regeneration of muscles, bones, tendons, and nerves. So as I mentioned at the beginning of this talk, since our body is in a constant state of function, injury, healing, and renewal, well, when you eat certain foods, it would make sense that we could influence kind of this regenerative process. And we don't have to any longer guess. It turns out studies are showing us this. Studies are showing that you can influence stem cell, which, remember, those stem cells are the primitive cells that have the capacity to facilitate healing in our bodies. And they can do this. We can influence stem cell proliferation or multiplication, and then differentiation into different types by simply the foods that we eat. Here are those flavonols or flavonoids again, right? Here's some alkaloids, some phenols, some sterols, all of these things from different food products, right? So resveratrol, so on and so forth, right? So here we go, right? So resveratrol enhances osteogenic differentiation and maturation. That means that bone cells improve their function, differentiation, etc. And where do we find that in? Well, we find that in all those purple, blue, and red sort of foods, right? All those berries and grapes and the peel of those deep colored grapes, etc. EGCG, right, which is found in green tea. Curcumin, found in turmeric. Ferulic acid, found in fennel. Picoatenol, found in passion fruit. Quercetin, found in red onions, etc. Apigenin, found in grapes, so on and so forth. So powerful stuff, cinnamaldehyde and cinnamon. We want to be thinking about moving forward our nutrition as a medicinal for our osteoarthritis, as a medicinal for our tendon healing, as a medicinal for our spine health. I want to give you 4 tangible tips tonight before we close up shop and take some questions. So number 1, I want you to enhance and normalize perfusion in your bloodstream. No matter what else you eat, maximize your nitrate-rich foods, right? You may not be ready to radically alter your diet yet, but if you're still eating the Mickey D's, the Chick-fil-A, or going to the barbecue joint, still have massive salads, load on the berries, right? Have a side of beets, so on and so forth. Now, if you are ready to try something radical, do my 4-week program, right? Go sign up now, download the 4-week PDF and do it. If you don't want to do that, you want something live, look in a couple, either tonight or tomorrow. I'll be putting up an offer to join my 4-week program for October with live sessions and recorded sessions, etc. Eliminate dietary cholesterol, reduce dietary saturated fats, reduce salt, right? All of these are going to be win-wins, not only for your musculoskeletal system, but also for your cardiovascular system. Perfusion and inflammation are the foundation of your health. So food radically alters that balance. So I want to take a look here with me, if you would. So I want you to start thinking about your orthopedic health in this framework, right? Your foundation for a healthy orthopedic system is eat more colors. Focusing on greens, blues, purples, reds, add spices in, right? That turmeric, that ginger, right? So on and so forth. Move every day, got to move. And physical modalities next, good therapists, chiropractors, massage, etc. Then injections where and when appropriate. And then, of course, surgery when needed. But jump to the top if you have that emergency situation, that fracture, that, you failed everything else. But do not jump to injections and surgery if you're not even addressing the underlying pivotal foundation of your orthopedic health. So again, maximize your perfusion, achieve a healthy BMI, reduce inflammation, and then maximize your muscular strength and flexibility. And as I mentioned, advanced interventions and surgeries as needed. So a bunch of good stuff right here on this slide. Pause it and memorize this. So I hope you enjoyed that. Some information to help you thrive and to recognize that you don't live in isolation. It's not that you eat some food and that food is, that's for my heart, but rather what you are eating on a daily basis radically influences at the cellular level your orthopedic health. So I always want to remind you of just how powerful you are. And I want to encourage you to continue to do your best. That's all that we can each do. Don't give up on the ideal just because you haven't achieved it, but rather use it as a motivator, as an encourager, as something we say, that's something I want to be moving toward, even if I never achieve it 100%. All right, let's see if anybody has any questions for me in here. Let's take a look. Well, thanks, Matthew, for being here. Love to have you here as well. Yeah, if you've got that big family history of hip and knee replacements, you want to take this seriously, right? And really focus in on what it is that you can do to decrease your risk, right? That BMI, that inflammation of the cellular level, et cetera. 15-year-old son has developed a ganglion cyst in his wrist aggravated by playing tennis. I had the same problem. Son mostly told any advice. So all is valuable to remember that, no matter how well we do with our diet, if you run your hand over with your car, it's still going to fracture. And repetitive micro trauma, like in tennis, right, with that repetitive movement of the wrist, and push-ups, et cetera, can certainly still lead to some inflammation, which leads to a little cyst forming. If that cyst is very bothersome and quite large, draining it, right? I do that all the time under ultrasound guidance. If it comes right back, you could drain it 2 or 3 times. You could inject a little PRP into it to see if it closes off and stops. And if you absolutely have to, you could go to surgery for removal of the cyst. But for many people, if they just modify a little bit, for example, don't do push-ups on the same day as playing a lot of tennis, often the cyst quiets down with that, along with some icing. Some people like to put castor oil on that area, and have seen some good results as well. So again, modify the activity, reduce inflammation, trial some topicals like the castor oil, et cetera. Failure to improve, consider drainage, and then go from there. Ideas to speed healing of a calcaneal stress fracture. Got it from upping my step count too much too fast. Yes, I mean, certainly number one is protecting the area, right? Getting on crutches for the first 2 weeks or 3 weeks, usually getting into a boot after that, minimizing time weight bearing. Certainly you could be in the pool swimming with your upper body and with your legs, but without pushing off. You could be really crushing the upper body to core the sideline leg lifts, making sure you don't lose out on your fitness. You want to maximize your nutrition, right? So again, the nitrates, those deep greens, get the blood flow improved in there. Make sure your vitamin D status is a good level. If you're not sure, maybe take 2,000 to 4,000 international units a day for the next 4 weeks. Vitamin K at 50 milligrams a day, some vitamin C at 1,000 milligrams a day. Healthy sources of calcium, like the dried figs and the deep green vegetables, and really crushing all of that to give it a chance to have a powerful effect. Time usually heals that well, and you just want to make sure that it's healing. Oh, thanks so much, Carrie, for your positive words. Well, I have another 8-week program. I don't think we're going to do 8 weeks right now, but I think October I'm going to do a 4-week. We're gonna have a pre-recorded video on Monday. We'll have a Thursday night talk, and then we'll try to do something Saturdays as well. And then, the daily emails, the encouragement, and some new topics, including on sleep and a couple other new topics that I've got. So if anybody wants to do it, would love to have you. Look for the sign up in the next day. I have a fractured tailbone from a fall. I'm 49, slim, whole food, plant-based. They want to test me for osteoporosis. Should I get tested or not? Knowledge is power. A DEXA scan is pretty low amounts of radiation. It's low risk. So, slender, if you are white, also a risk. And so a slender white female has the highest risks of osteoporosis. And so, certainly having knowledge can allow you to make informed decisions. If you do get the DEXA and it does show, a Z-score, more than 2.5 standard deviations, which would be an osteoporosis diagnosis, it doesn't mean that you necessarily need to go jump on drugs. What it does mean is that you need to be serious about your bone health. Are we doing enough weight-bearing activities? Are we maintaining good reaction time and balance? Do we need to start a weighted vest program? All this sort of stuff. So a lot of things to think about. So if, having that knowledge will give you tools, well, yeah, get in there and, get the DEXA scan. Castor oil seems to be a little bit of a, kind of witch magic as far as I'm concerned. Exactly how it works for some of these soft tissue issues, I don't know, but it's hard to argue with anecdotes from people with regards to, putting on castor oil packs onto areas. And for some people seems to be extraordinarily powerful. I tend to have a sliding scale of evidence that I work by. If something is very low risk, low toxicity, and low cost, I'm certainly open to trialing it, right? So yeah. Let's see here. I sprained my index finger over 4 weeks ago. Hopefully 4 years, still painful and some swelling. Any advice? Thank you. A couple of things. One is, if you don't treat it aggressively day one, sometimes you get behind the 8 ball with these finger sprains. So first, you just want to make sure you don't have a fracture and you don't have a full rupture of something like the UCL ligament or something of that kind. If those have all been ruled out, then, ideally, if you truly sprained it, day one probably should have been put into like a splint. And after splinting it for 1 to 2 weeks, then coming out and beginning, gentle hand therapy to restore motion and decrease pain. Because, excuse me, again, if you have a musculoskeletal anatomic trauma to the tissue, regardless of what your diet is, you can still damage the ligament. And the ligaments then scarred out and they take time for healing and recovery. Swollen at the knuckle. Yeah. So, again, would have been nice to make sure there's no fractures and, was it treated aggressively, and then go from there. Weighted vest might be helpful. Yes. Normally so another thing at Carrie, I'd probably want an MRI of your pelvis just to look at the extent of the fracture, how much edema there is, et cetera. Because if there's a lot of edema or swelling around the fracture, then you really want to make sure you protect that area long enough. Also, you just want to make sure there's no fracture or edema in the sacrum. If it's all just in your coccyx, well, that is what it is. Use your donut pillow, avoid sitting on that area, protect it, and time, right? 6 to 12 weeks for that to fully resolve. If it's not improving, then an MRI of the pelvis can look at the sacrum and the coccyx and see if there's still edema or swelling in the bone. And then based on what it looks like, then we can decide, if there is edema, then it just needs longer to heal, et cetera. If there's no edema, but it still hurts, then you can do things like prolotherapy or PRP injections into that area to help restabilize the coccyx. Well, we'll try to do some more long lectures for you. I'm trying to start little by little doing more of them now, so that we can hopefully inspire folks, right? Because again, when I go to my deathbed in not too long, I want to know that I left the world better. And so I appreciate your feedback and I appreciate you guys showing up hungry to learn, and I'll keep trying to bring worthwhile information so that I can share it with you and hopefully improve your lives, because that's really at the heart of all of this, my goal. So please share the message with other people, share the videos, and let's keep getting together and having fun. And hopefully I can be of value to all of you. All right, everybody, have a wonderful evening, and thanks so much for joining. And I look forward to seeing you all soon and having fun together. All right.